Hello everyone, my name is Faisal Namaz. I'm studying in LNU doing PS Biology course. Now I'm going to discuss about the psychiatric disorders, namely the psychoanalysis and the psychological therapy. First of all, I'm going to discuss about the psychoanalysis. What are the psychoanalysis, etiology, manifestation, diagnosis and signs and symptoms. So first of all, going to discuss about psychoanalysis. Psychoanalysis is a set of theories and therapeutic techniques related to a study of the unconscious mind, which together form a method of treatment for mental health disorders. Psychoanalysis is a controversial discipline and its validity as a science is contested. Nonetheless, it remains a strong influence within psychiatry, more so in some quarters than others. Psychoanalytic concepts are also widely used outside the therapeutic arena in areas such as psychoanalytic literacy criticism, as well as in the analysis of film, fairy tales and other cultural phenomena. So what are the basic tenets which are through the psychoanalysis include? First of all, what's basic tenets? A person's development is determined by often forgotten events in early childhood rather than by inherited traits alone. The second one is the basic tenets is human behavior and cognition are largely determined by instinctual drives that are rooted in the unconscious. The third basic tenets are attempts to bring those drives into awareness triggers resistance into form defense mechanisms, particularly repressions. The fourth one is the conflict between the conscious and unconscious material can result in mental disturbances such as neurosia, neurotic traits, anxiety and depressions. The fifth one is basic tenets are the unconscious material can be found in dreams and unintentional acts including mannerisms and slips of the tongue. Liberation from the effects of the unconscious is achieved by bringing this material into the conscious mind through therapeutic intervention. The seventh one is the last basic tenets, which includes the centerpiece of the psychoanalytic process is the transference whereby the patients relieve their infantile conflicts by projecting onto the analyst feelings of love, dependence and anger. So these are the basic trends of the psychoanalysis. So now I'm going to discuss how it is diagnosed and treatment. Using the various analytic and psychological techniques to assess mental problems, some believe that there are particular constellations of problems that are especially suited for analytic treatments, whereas other problems might respond better to medicines and other interpersonal intervention. To be treated with psychoanalysis, whatever the presenting problem, the person requesting help must be demonstrate a desire to start an analysis. The person wishing to start an analysis must have some capacity for speech and communication. As well, they need to be able to have a developed trust and insight within the psychoanalytic session. Potential patients must undergo preliminary stage of treatment to assess their amenability to psychoanalysis at that time, and also to enable the analysis to form a working of psychological model which the analysis will use to direct the treatment. Psychoanalysts mainly work with neurosis and hysteria in a particular. However, adapted forms of psychoanalysis are used in working with schizophrenia and other forms of psychosis or mental disorder. Finally, if prospective patient is severely suicidal, a longer preliminary stage may be employed. Some within session which have a 20 minutes break in the middle. There are numerous modifications in technique under the heading of psychoanalysis due to individualistic nature of personality in both analyst and patient. The most common problems treatable with psychoanalysis include phobias, conversions, compulsions, obsessions, anxiety attacks, depressions, sexual dysfunction, a wide variety of relationship problems such as dating and marital strife, and a wide variety of characters problems, for example painful shyness, meanness, obviousness, workaholism, hyperseductiveness, hypermotility. The fact that many of the such patients also demonstrate defects above makes diagnosis and treatment selection difficult. So what are some problems which treated by psychoanalysis include their depressions, the generalized anxiety, sexual problems, the problems in the sex, self-destructive behavior, persistent psychological problem, disorder of identity, to lose their identity, psychosomatic disorders, phobias, the fear of anything, obsession compulsive disorder. These are the some treated which includes in the psychoanalysis. So how their psychoanalysis by treated this type of disorders. Although many adults suffer from attention defect, hyperactivity disorder or ADHD, symptoms begins in childhood and therefore diagnosis and treatment usually due to. The psychoanalyst can help identify problems in self-regulations as well as the unique capacities a person with ADD often has. Now the second disorder is psychological therapy. So these therapy, how they are diagnosed, how their etiology and causes, signs and symptoms. Now I'm going to discuss about what are psychological therapy. Psychological therapy is a collaborative space to explore your difficulties in a safe and confidential setting. We aim to help you better understand your feelings in the context of your past experience. Therapy provides a supportive, non-judgmental environment where you might feel more able to talk open about your experiences. Your therapist and you will work together to make changes that you want to achieve, to feel a greater sense of happiness, empowerment, or perhaps to feel less affected by particular experiences. So what are the different approaches of the psychological therapy? So psychoanalysis and psychodynamic therapy. This approach focuses on changing problematic behaviors, feelings and thoughts by discovering their unconscious meaning and motivations. So there are different approaches like behavioral therapy, cognitive therapy, humanistic therapy, integrative or holistic therapy. There are many different psychological therapies. However, they all have the same objective on common therapeutic goal. They seek to facilitate changes to our well-being. Thus, instead of asking ourselves which of these psychological strategies is the best worst, we should first ask ourselves what we need. So there are many types of psychological therapy. According to psychological therapy, there are behavioral therapy. So we already know that how they're behaving, their attitudes going to changes, and the cognitive analytic therapy, rational emotive behavioral therapy, psychoanalytical therapy, and dynamic interpersonal therapy. These are the types of psychological therapy. Now the treatments, how the psychological treatments occurs. Psychological treatments may be used alone or in combination with the physical treatments. They provide some of the most powerful means of treating many types of mental illness. The three main types of psychological treatments are dynamic psychotherapy, behavioral psychotherapy, and cognitive psychotherapy. There is much debate about the relative merits of these, and as will be seen in the section, and appear to have a role in deciding which psychotherapy, if any, to recommend to patients. It is important to consider the nature of their problems, as well as how receptive they are likely to be in different approaches. Now I'm going to discuss about some signs and symptoms of which included in this psychological therapies. The signs and symptoms of the psychological therapies are feeling sad or down, confused thinking and reduced ability to concentrate, excessive fears or worries, or extreme feelings of guilt, extreme mood changes of high and lows, withdraw from friends and activities, to separate living alone, do not talk with others, do not talk with just sitting in the room, significant tiredness, low energy, or problem in sleeping. So these are the same signs and symptoms of the psychological therapies. So means if there is any problem, they're sleeping, their mood changes, high and lows, they not concentrate to ability to work or thinking. These are including psychological therapy. Although psychiatric medication don't cure mental illness, they can often significantly improve symptoms. Psychiatric medication can help make more treatments such as psychotherapy more effective. So how their medications are used for this disorder to get reduced the mental effects. So there is the medications which is used for the psychological therapy. These are antidepressants, anti-anxiety medications, mood stabilizing medications, antipsychotic medications. These are the drugs which are used to treat for the medications of psychological therapy. What are the drugs are used to treat this type of depressions? When treating depression, several drug options are available. Some of the most common use include selective serotonin reuptake inhibitors (SSRIs), such as citalopram, that's called Celexa, escitalopram, oxalate, fluoxetine, fluvoxamine, prosectine, HCI, and sertraline. The other one is the selective serotonin and non-epinephrine inhibitors, such as desvenlafaxine, desvenlafaxine succinate, duloxetine, levomilnaxipran, viloxazine, and novel serotonergic drugs such as vortiostatine, formerly called Brintellix, or vilazodone. The older tricyclic antidepressants such as the amitriptyline, impramine, nortriptyline, and doxepin. The drugs that thought to affect mainly dopamine and norepinephrine, such as bupropion, Wellbutrin, monoamine oxidase inhibitors such as phenelzyne, bromine, tetracyclic antidepressant that are noradrenergic and specific serotonergic antidepressants such as mirtazapine has proved successfully treating this type of depressions. Considered a medical food or neuronutraceutical by the FDA, it is the active form of the B vitamins called folate and helps to regulate the neurotransmitters that control moods. Although it is not technically a medication, it does require prescriptions. So now finally these are the medication and treatment of the pharmacological and medical managements that occur. Now I'm going to lastly this prognosis. So in some cases psychological disorders can be life-threatening. Seek immediately medical care. If you are about to have any dislike, treating symptoms including being a danger oneself to others include treating to irrational or suicidal behavior. So we kind of have to be adjusted to everyone. So this is finally this type of disorder occurs here in psychological therapies. Thank you and have a wonderful day to all of you.